you. This is the clinic. We're going to be going through the first part of our pre-health screening, and this is going to be our PAR-Q. So go ahead and take a seat. Alright, so initially I'm going to have 7 questions to ask you, and then we're going to see if we're going to need a physician's release so that you're clear to work out, okay? So the first question I have for you, has your doctor ever said that you have a heart condition?
No.
Or high blood pressure?
No.
Okay. Do you feel pain in your chest at rest, during your daily activities of living, or when you do physical activity?
No.
Okay. Do you lose balance because of dizziness, or have you lost consciousness in the last 12 months?
No, I haven't.
Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure?
No, I haven't.
Are you currently taking prescribed medications for a chronic medical condition?
No, I am not.
Do you currently have or have had within the past 12 months a bone, joint, or soft tissue or problem that could be made worse by becoming more physically active?
No.
Okay. Has your doctor ever said that you should only do medically supervised physical activity? Now that we have answered those questions right there, and we've answered no to all the questions, you're actually cleared for physical activity. So what I'm going to have you do, I'm going to have you write your name right here, write the date, your signature, and we have a witness for you today. Okay? Alright. And the witness today is going to be Colleen. Sign right there. Alright. And it looks like we're all clear to go. Congratulations. In the case that he was not cleared by a physician, we would have him take this to his physician, and this would be a follow-up form, making sure that he would be cleared to work out. These are the materials that we're going to be needing for the pre-health screening. After measuring the circumference of the bicep belly in centimeters, we're going to pick the appropriate cuff size for you. So we have a small adult size, 26.1 centimeters to 40.9 centimeters in circumference. And we have a large adult size, 34.3 centimeters to 50.8 centimeters. Now that we've chosen the appropriate cuff size, we're going to make sure that we put the cuff around the center of the belly. Make sure that it's nice and firm, but not too tight. Always make sure to clean your stethoscopes so you don't get a really bad ear infection. taking the patient's blood pressure, make sure that the patient does have his arm well rested. And you want to make sure that your tools are set up properly as well. You can loosen the valve, but we want to make sure that the valve is completely tightened and the reader is at eye level before you take the blood pressure. We're going to get the blood pressure to be about 180. $120, 83, and release all the way. When you set up the bike, you want to make sure that the client has his hip bone lined up with the seats. So what I'm going to have him do is I'm going to have him lift his leg up to 90 degrees, his left leg. And we're going to find where that seat goes right to your hip bone, your acetabulum. Okay, so it's about set right here. Now he's going to go ahead and step on. And we're all set and ready to go. For the first trial stage, for 2 minutes, we're going to make sure that he is at 1 kp, 60 revolutions per minute.
It's too small.
Just to explain what it is. Just test it. Oh, it's all of them. For this one. So. Roll. Alright.
Every minute we should be getting the exercise blood pressure.
What do I have to do? Well, no, that way it's all in one video. Yeah, so I don't have to do it with you.
We're going to go through the same protocol.
Oh, well, yeah.
Make sure that the valve is tightened all the way and that the reader is at eye level.
Okay, so I'm gonna pick my head in.
We're going to get it to about 180.
Yeah.
$142 over 184.
Is it 1.5? Yeah.
At the 2 minute mark, we're going to increase the resistance to 1.5 kp. We're still going to keep 60 revolutions per minute. And we're going to have him pedal for another 2 minutes and take his blood pressure.
It should be safe.
At 4 minutes, we're now going to increase the resistance to 2 kp. And we will continue to be at about 60 RPMs. And take his blood pressure.
I can feel it though. I can definitely feel it. You want to have contact? I also squeezed my hand. Yeah, that was like testing it up. That was not my house though. Maybe it looks right.
You're like down. It doesn't tie in. You should hold though.
After the 6th minute, have the patient rest for 5 minutes. Go ahead and rest. And take the blood pressure after 5 minutes of rest.
Now we're gonna have this bicycle for about 3 minutes with 1 kilogram of resistance here. And then after that, we'll measure heart rate as well as blood pressure.
It's like 122 over 81. No, it's not.
It's the second meter.
Whatever. Well, also, it's mine doesn't sound like it. It sounds. No, it sounds really messed up. Maybe make sure you do the right one. I wrote this one too.